Hello, and welcome to the video series on understanding culturally and linguistically appropriate services. This video is on the overview of engagement, continuous improvement, and accountability. The objectives for this learning session are to achieve the following: examine why the national class standards are important, identify the engagement, continuous improvement, and accountability standards, and explore different approaches to implement the engagement, continuous improvement, and accountability standards within your organization. So to give a little bit of background on what are the national class standards. The national class standards were first implemented in the year 2000 by the Health and Human Services Office of Minority Health to help address and reduce racial and ethnic health and medical care disparities. And then after feedback from public forums in 2013, the standards were revised to what we have today to increase user-friendliness and broaden the guidelines. National class standards were developed to ensure the availability of culturally and linguistically appropriate healthcare and medical services of anyone and everyone who needs care. CLAS provides organizations with 15 action steps intended to advance health equity, improve quality, and help eliminate healthcare disparities by establishing a blueprint for health and healthcare organizations. There is no single correct way to implement the national class standards. An organization may decide to implement some, but not all of them, or they may wish to implement some sooner than others. Today, we are going to review the engagement, continuous improvement, and accountability theme, and this includes standards 9 through 15. The engagement, continuous improvement, and accountability theme is theme 3. This theme identifies the importance of establishing both individual and organizational responsibility for implementing CLAS. Effective delivery of CLAS demands actions across the organization. This theme focuses on the support necessary for the adoption, implementation, and maintenance of culturally and linguistically appropriate policies and services. All individuals are accountable for upholding the values and intent of the CLAS standards. This means that everyone in the organization has a part in implementing and living the CLAS standards. In addition, Theme 3 outlines how organizations should continually keep in touch with the communities they serve to be aware of their clientele, the languages they speak, and the cultures they represent. Standard 9 has to do with infusing CLAS throughout the organization's planning and operations. So this will help organizations make CLAS central to the service, administrative, and supportive functions, as well as link CLAS to other organizational activities. So really, this means all of your plans that your organization is developing are culturally and linguistically appropriate, and making sure that all of your plans have CLAS within them. They should not be an add-on, but a way to modify what you currently do. Examples of implementation activities for Standard 9 are to develop mission and value statements that reference the organization's commitment to serving a diverse cultural population, create a CLAS committee that is responsible for goal setting, implementation of strategies, and gaining feedback from staff on systems improvement, develop a strategic plan with participation of consumers, community, and staff who can convey the needs and concerns of all communities and parts of the organization affected by the strategy, and to hold staff diversity events and celebrations honoring differences in cultures. Standard 10 has to do with conducting organizational assessments. This will help an organization assess the performance and monitor progress and implementation with the CLAS standards. Collecting information about the organization and the people it serves can be used to tailor and improve services. Examples of Standard 10 for implementation activities are to develop staff performance evaluations that include class-related objectives and measures, include questions related to class performance in all community surveys and other methods when obtaining input, and to hire an outside consultant with expertise in cultural appropriateness to facilitate professional development and organizational improvements. Standard 11 has to do with collecting and maintaining demographic data, which can help organizations accurately identify population groups within a service area and monitor individual means, access, utilization, quality of care, and outcome patterns. This may also help with outreach and community-based initiatives, as you need to know who you are doing your outreach to. Examples of implementation activities for Standard 11 would be to consistently strive to improve on collection of race, ethnicity, and language data in your service area. Ensure community needs assessment includes percentages of ages, genders, religions, refugees and immigrants, income distribution, employment status, languages spoken or read, non-English speakers, literacy levels, and types of alternative complementary services, and also to provide ongoing data training and evaluation to staff. Standard 12 has to do with conducting assessments of community health assets and needs. This helps an organization to determine the service assets and needs of the population in the service area. This can also assist with a resource inventory and gap analysis of what is needed, which can help to implement services based on your community assessment. Examples of implementation activities for Standard 12 would be to conduct community surveys to assess how the organization is doing on a regular basis. Use community survey information to plan and implement new services. Reach out to other sources in the community, such as faith-based organizations, social workers, and managed care organizations, to collect data and plan and implement services that respond to cultural and linguistic characteristics of the service area, and to conduct patient satisfaction surveys on a regular basis, analyze the data, and use it to inform services. Standard 13 has to do with partnering with the community. This will empower members of the community in becoming active participants in the healthcare process. Examples of implementation activities for Standard 13 would be to use surveys, public meetings, focus groups, advisory committees, and coalition building to obtain community input to respond to the needs and preferences of the culturally and ethnically diverse groups served in the area. Participate in community events targeted to people of color to build collaborative partnerships in a participatory environment, and to share the lessons learned at these events with management and leadership staff to expand collective knowledge of local cultural practices and beliefs. Standard 14 has to do with creating a conflict and grievance resolution process that is culturally and linguistically appropriate and are open and transparent and allow for two-way communication and feedback. Examples of implementation activities for Standard 14 would be to train staff to serve as mediators in cross-cultural conflicts or have a designated independent cultural mediator to help resolve conflicts, create a set of conflict and grievance resolution policies which value organizational respect for cultural norms, and to develop a policy that describes how your grievance system complies with anti-discrimination regulations. Our final standard is Standard 15, which has to do with communicating the organization's process, which will help organizations convey information about efforts and accomplishments in meeting the national CLAS standards, as well as building and sustaining communication on CLAS priorities and building trust between the community and the service setting. Examples of implementation activities for Standard 15 are to announce organizational changes or new programs in response to CLAS standards via standalone documents, grant applications, newspaper articles, television, radio, and postings on websites. To disseminate strategic plan to donors and post on your organization's website, and to provide written updates on CLAS-related activities, progress, and challenges. Also to make written information available to the public annually, if not more often. So let's recap: engagement, continuous improvement, and accountability. This theme includes standards 9 through 15. The goal is to make CLAS central to the organization's service and administrative and supportive functions. The goal is also to ensure that health and healthcare organizations obtain demographic, cultural, linguistic, and epidemiological baseline data. And this can be quantitative and qualitative. Also, it's important to update the data regularly to better understand the populations in the service areas. This can be used to tailor and improve services. It's also important to build and sustain communication on CLAS priorities and foster trust between the community and the service setting. In closing, health equity is the attainment of the highest level of health for all people. Culturally and linguistically appropriate services are increasingly being included in or referenced by local and national legislative, regulatory, and accreditation mandates. Both the Joint Commission and the National Committee for Quality Assurance have established accreditation standards that target the improvement of communication, cultural competency, person-centered care, and the provision of language assistance services. The pursuit of health equity must remain at the forefront of our efforts. CLAS is a way to improve the quality of services provided to all individuals, which will ultimately help reduce health disparities and achieve health equity for all. So thank you for participating in this video series. If you have any additional questions, please reach out to Superior Health.